How does pelvic inflammatory disease, PID, cause Fitz-Hugh-Curtis syndrome? Imagine a woman with a pelvic infection caused by bacteria like chlamydia or gonorrhea. These bacteria infect the upper reproductive organs, including the uterus, fallopian tubes, and ovaries. This condition is called pelvic inflammatory disease, and it often results from sexually transmitted infections. If untreated, the bacteria can spread beyond the pelvis, reaching other parts of the abdomen. Fitz-Hugh-Curtis syndrome is a rare complication of pelvic inflammatory disease. It involves inflammation of the outer covering of the liver, known as the liver capsule. This inflammation leads to the formation of fibrous bands or adhesions between the liver and the abdominal wall or diaphragm. The process begins with the bacteria traveling upward from the cervix or vagina through the uterus and fallopian tubes into the peritoneal cavity, which is the space surrounding the abdominal organs. From there, the bacteria can directly infect the surface of the liver capsule by spreading across the peritoneal surfaces. Sometimes the bacteria do not directly invade the liver capsule but instead trigger an immune response. The body's immune system reacts to the bacterial presence, causing inflammation even if the bacteria are no longer present in the liver area. This immune-mediated reaction can lead to the development of adhesions and inflammation of the liver capsule, which is characteristic of Fitz-Hugh-Curtis syndrome. The inflammation causes sharp pain in the upper right part of the abdomen, especially during breathing or movement. This pain can be mistaken for other conditions like gallbladder problems or kidney infections, making diagnosis tricky. Fitz-Hugh-Curtis syndrome occurs in about 4 to 14% of women with pelvic inflammatory disease, and it is more common in teenagers due to their anatomy. In essence, pelvic inflammatory disease causes Fitz-Hugh-Curtis syndrome when bacteria from the infected pelvis spread to the liver capsule, either directly through the peritoneal cavity or indirectly through the bloodstream or lymphatic system. Sometimes, the immune system's response amplifies the inflammation, even without bacteria directly invading the liver area. Recognizing this connection highlights the importance of early diagnosis and treatment of pelvic infections with antibiotics to prevent complications like Fitz-Hugh-Curtis syndrome. Always consult a healthcare professional if you suspect an infection or experience persistent abdominal pain, as prompt treatment can make a significant difference.